Finding somebody that works for you.
Yes.
Yep. And I think people don't know that. They're like, I've had this doctor for 20 some years, which is great. But within psychotherapy or therapy in general, I might be good for you at a certain point in your life because I can help with those pieces, but somebody else might be a better fit somewhere down the road. And so I just try to get people to feel comfortable with that process, invest in themselves, like the book says. Because the other piece I wanted to is that earlier I was like, cognitive behavioral therapy, dialectical therapy, EMDR. People don't really care about that.
They hear those phrases and they're like, okay.
Yes. They want something
Does
tangible.
This include a copay?
Yep, yep, and practical and things like that. I think it is knowing that you can make it to the other side, because I've made it to the other side.
Mm-hmm.
So I think that piece is always there. And then I know what it feels like to be on the other end of it and to be able to help. Again, it's almost indescribable, besides magic is the word. But then I get to hold a person's future for them. I get to look at them and be like, I can see it. We just got to get there.
Yeah.
And I'm on this ride with you until you don't need me anymore. And so that's what I say to patients. Hey, Kaitlyn, do you know things about this? Can we do it this way? Can we do this? And so that's you investing in the process, right?
Right.
And so I'm more than willing to do that. I just won't do the work for you. Or if I want it more than you, that's also a boundary then that I have to start. And then I would just say, it feels like I want it more than you do. And that's part of that honest conversation.
So you'll challenge them.
Absolutely.
Yeah, because you want to get them going.
Yep, because I was literally like, I'm in it with you, and please show up next week. I mean, when you have people in your office telling you about politics and how it's affecting them and how, based upon different things that may or may not happen, that they may not want to stay on this earth anymore, right?
There's a lot of people.
How could I not? How could I not talk about those pieces or the scariness, right? Like, there was just so many layers, and so it took, and I always will keep the science of it, but it took the art, and then it just made it that way. And so then now I get to do a blend of it. So I'm much more comfortable as a clinician than I was post, right? Yeah.
Yeah.
But now, I get to play with all sides of it. And then I just think that the book and the podcast are just ways that we can expand, because psychotherapy isn't what we necessarily think it is. And we should be meeting people where they're at and making it just accessible.